I think it's very interesting. This is an MS meeting that's devoted to progressive MS, and I think that's an area where we've been lacking, and currently there's a main emphasis and focus on it because we have no documented therapies. So I think this is interesting because it's a multifactorial approach talking about what might be unique pathology, differentiating features, new clinical insights into the disease, et cetera. So I think it's a very nice time to try to learn more about progressive MS. I think really most of the people that are here have a vested interest in MS. So this is an interesting meeting because it's a specialty meeting focused around one disease. And so really you see a lot of people in the audience who you recognize are extremely knowledgeable about MS. And I think it also indicates that the level of discussion of the disease at some features is in like a much higher, let's say, it's at a much higher level for people that may already have great expertise in MS. But certainly for anybody interested in MS, it's a very fun meeting. Well, I think these are very good forums to be saturated in knowledge about MS. You're away from the office, you're away from phone calls and demands and meetings. You're able to sit there and listen and think and interact and talk and take your time, and it's all focused around getting smarter about MS. So I think it's a great opportunity to be brought up to date over a finite few days. So that's a very precious experience, I think. Well, I think the very first presentation was very interesting in gleaning new clinical insight. That used a very large global registry, the MS Base, and it looked at MS patients who had moderate disability. They were in the EDSS range from 3 to 6.5. Now that's a range where generally relapsing patients are transitioning to secondary progressive disease. And they looked at development of worsening on the EDSS in several different groups, and it was extremely variable. There were quite different degrees and time courses for worsening in this range. And they found two important associations. If these moderately disabled MS patients had superimposed relapses, that was a negative on development of disability, that they were likely to go up on their EDSS faster. Secondly, they also looked at use of disease-modifying therapies and what they called more effective disease-modifying therapies. And if the moderately disabled patient was on an effective disease-modifying therapy, that lessened the likelihood that they were going to develop disability, or the speed at which they were going to develop disability. Now, this has not been published yet. This was new data, but I think that's very interesting because the dogma has been relapses don't have any impact once you're at this stage, and that everybody worsens at about the same pace, and that's clearly not the case. And I think it was very kind of satisfying to kind of recognize that relapses are a bad thing in moderately disabled MS patients, and maybe being on a good treatment can be helpful to these moderately disabled patients. What they agreed was that they were going to do an expedited review once they submitted. So the announcement that came back said that they've made some recent new revisions, and because this would be potentially a first treatment for progressive MS, they were going to, once the packet was submitted, do an expedited review, which I think is within 6 months. So once they receive the packet, which they haven't yet, my understanding is, I think that they're going to apply for approval for Ocrelizumab for both relapsing MS and primary progressive MS. And for the primary progressive, they've said that we'll make a decision within 6 months of getting that packet, but it's not actually an approval. at this point. I think it would be very exciting, but I think you really want to then feel that it absolutely does treat the disease, and that's where I need to see some further data. The interferon betas, and there are a number of interferon betas, are tried and true standby treatments that go back to the 1990s. So the advantage is that you know exactly what you're getting. You have people that have been on it 20 plus years. You know there are no surprises. You know exactly what the adverse effect tolerability profile is. So I think for patients that are on it and doing well, you're really not very tempted to come off and try a new treatment if you're not having any issues. I think probably the market for the first-line parenterals is going to slowly shrink over time. I think if an MS patient puts a great premium on wanting a treatment that's been available for a long period of time, then that's something that makes one of the interferon betas attractive. So we haven't seen them disappear, but I think their use is going to gradually decrease as we get multiple options.